It's the first panel discussion of the evening. I want everyone once again to give a big round of applause here for our guests, our panel of experts. It's a very, very important conversation that we are having. First up, we are cutting straight to the chase here. We are talking about India's healthcare, the equity in India's healthcare. There's a lot of conversation. The Honorable Minister just now spoke about India's roadmap, the development story, Viksit Bharat 2047. But the bigger question that comes to our mind when we talk about Viksit Bharat or the development of India is it equal for every single community? Is it equal for every single Indian? Is every single Indian feeling that development, India being the fastest growing economy, and particularly in terms of healthcare, that becomes an even more crucial conversation. We saw during healthcare crises like COVID, how important it was. The lack of equal opportunity when it comes to healthcare was glaringly visible. And India's government, of course, has tried its best to fix those gaps. Dr. Guleria, let me first start with you. You've been the face of India's response during these healthcare crises. Help us understand where are these gaps. We see India having very good policies on paper. We talk about India's, the Indian government doing a lot to ensure that every single marginalized community is touched, to ensure they get a good healthcare system. But there still is a lot of gap when it comes to policy and practice on ground. In your experience, what are the biggest gaps, and in the next few years, what does India need to do?
Thank you very much. I'd like to first thank Times Now for inviting me and congratulate them on the second Health Summit. You're very right. We have a lot of challenges. The Government of India has made a lot of steps. Like you said, policy decisions. Implementation is one of the big challenges. And as was mentioned by the Honorable Minister, that India is a very diverse country. We have an urban-rural divide. Majority of specialist doctors are more in the urban areas compared to the rural area. There's also a big issue of healthcare being both in the government sector and in the private sector. And the cost of healthcare in the private sector is very high as compared to the government sector. But in the government sector, it's very difficult because good hospitals, you have to, the crowd is huge, waiting is huge. So challenges are of increasing the infrastructure, implementing policies, and understanding how the health scenario in our country is changing. There is also a paradigm shift in the health scenario that is happening in our country. And also there is technology which is coming in, which we need to harness to see how we can really use it. I think, as was mentioned, we need to look at frugal innovation. How can we innovate in a way which is cost effective and be able to provide universal health care to all? The mission is to do that. Challenge is the implementation part as far as health is concerned. And I totally believe that health should be a social responsibility. Healthcare for all is something that should be provided irrespective of where you are, what is your socio-economic status. And if we can do that for 2047, it will be a huge achievement that every citizen, no matter where he is, gets high quality health care. That would be something that needs to be implemented. There are policies in place. Implementation is the challenge.
Absolutely, very rightly said. Implementation is a challenge, and I think everyone present here has had that experience where you look at certain districts, certain states in the country which are left far, far behind when it comes to healthcare. Professor Mehra, a similar question to you as well. We talk a lot about how there's a lot of progress that India is making when it comes to research, when it comes to policy. Very big policies are announced as well, but when it comes to on-ground implementation, we still lack in terms of that. In your experience, where are we missing the bus?
Well, first of all, thanks to the Times Network to give me this opportunity to come over here. I think the theme of this discussion is very apt, that there are disparities and gaps in the healthcare. And I think there are three things that are very important here. One is the data, research, and of course the policy of the government. Now, these are very important issues, and these can address India's persistent health disparities that we see by creating evidence-based, need-oriented, accountable health systems over there. And I want to talk to you each of these three. Number one, of course, how can data help? Today's word is data science. You know, data has come up as a very big issue. Everybody's talking about data science there. I'm a member of the International Core Data. So we need robust data, robust information for identifying and addressing the inequalities through enhancing policy design, maternal mortality, nutrition, vaccination gaps and all that, mapping disparities, and here data from the Ayushman Bharat, the digital mission as we heard, or the National Family Health Service is very, very important. It will help us and improve our services there. The second issue is the research. How does research help? We need research, of course, focused on analyzing the complex causes of health inequalities. We need research to find effective interventions there. The need is to develop deep understanding of social determinants. The social determinants like education, housing, sanitation, and of course, discrimination practices. And number two would be fostering innovation towards affordable and accessible healthcare technologies. And you mentioned about the AI and all that. Develop AI tools that can help us bridge the urban-rural divide there. And develop evidence-based interventions by involving community. I think this is a very important issue, and we'll talk about it even more, because I have had the experience of really on this issue that involving community members in finding solutions is really very, very important. You see that in rural India, even now, people use their own sort of systems of cure. You know, they don't go to the hospitals and all that. And there is this foundation called the National Innovation Foundation, started by the Department of Science and Technology, Government of India, and I chair their health issue over there. And they really have their scouting system. They have their scouts which go from one part of the country to the other and try to look at those claims, you know, the claims made by those people in the rural side that they can cure those diseases, and those can be also brought forward. And the third issue, as I talked about, how can government policy help? Of course, we heard a lot from the Honorable Minister. Actually, it was very, very comforting to note that there are the number of medical colleges have grown from 382 to 809. AIIMS-like institutions have really grown, and the allocation of funds to the health sector has grown. But we still need to develop a robust institutional and regulatory framework to ensure that the health systems are designed and implemented to promote equity rather than disparities. We need to focus on resource allocation, prioritize primary health care, and address the last mile gaps in rural India. Expand the universal health coverage there. And of course, Ayushman Bharat and other schemes are doing an excellent job. And I think we have seen that within the last one decade, the coverage has been remarkable there. So these are my initial remarks on all of those three issues that we talked about.
Well, those were some very detailed initial remarks that you made there. And one of the interesting things you spoke about is how it's comforting to know what the Honorable Minister had to say. And one of the important things, Dr. Guleria, she said was universal health coverage is the core of the national health policy. The reality in India right now, while we talk about a lot of advances when it comes to medicine, when it comes to hospital technology, the reality is that a majority of the population in this country do not get medical facilities beyond primary healthcare center. Now, when you talk about issues, chronic illnesses such as diabetes, asthma, hypertension, it affects the marginalized community the most. And these are people who do not go beyond primary healthcare centers because they can't afford it. That's the reality. How do we make sure that these primary healthcare centers, which have become our first line of defense in a way, how do we make them more robust in the coming years?
So I think this is very important, and like I had mentioned, there is an important issue to understand that in India there is a paradigm shift as far as the burden of disease is concerned. If you look at data from 1990 to 2016, there has been a huge shift in the burden of disease from communicable diseases, maternal mortality, infant mortality, to non-communicable diseases. And currently, the bulk of the burden of disease, almost 60% of the burden of disease is non-communicable diseases. Cancers, hypertension, diabetes, chronic respiratory diseases, chronic kidney diseases, heart diseases. And unlike the communicable diseases where you had, let's say you had dengue or you had malaria, you took treatment, you became all right, the health system treated you and you were all okay. But if you're looking at non-communicable diseases, these are diseases which are going to be there for life. So the issue is being able to catch these patients even in rural area and being able to provide equitable healthcare to them throughout their life. And that is why I think the focus has to be more on preventive health, early diagnosis of hypertension, diabetes. In rural India, many people don't get their blood pressure checked. They don't even know they have hypertension or diabetes for that matter. Unless they get end organ damage, they start having hypertensive heart disease or have chronic kidney disease because of diabetes. So I think the focus in the government also has to be what has already been started in terms of wellness centers. How can you do a good screening for all of these non-communicable diseases and catch them early, especially in rural India? And it's not difficult to do. You just need to have a simple set of diagnostic tests which can be done to diagnose early cancers. If you look at cancers in India, 60% of cancers are preventable. So you can actually prevent majority of cancers by good screening, by good hygiene, by decreasing tobacco use. A lot of those such things can be done. So I think there has to be a focus at primary level on preventive health rather than focusing only on curative health, that we build more hospitals or we build more centers. We will not be able to afford that if we start looking at that end of the tunnel, that we're going to cure all our patients who have hypertension, diabetes. We should see what we can do to prevent them from reaching that stage, especially at an early, let's say at a rural India where these things are not picked up early. And secondly, use technology to reach out to these people. COVID was one very good example. You could have teleconsultations with people who are in remote areas also and provide them care. Everyone learned how to monitor their oxygen saturation, how to look at their symptoms. So it's possible by using teleconsultation, e-Sanjeevani, as the Honorable Minister mentioned, to be able to provide healthcare even in rural India and use technology. We have a lot of wearable devices coming in, a lot of innovations by Indian companies where you can diagnose all of these diseases in a very cost-effective manner and be able to intervene early rather than late. So I think the focus has to shift more and more towards preventive health, early diagnosis, accepting the fact that we are shifting, the paradigm shift is occurring towards non-communicable diseases. And also, of course, as was mentioned, this century, the last 25 years, has been a century of outbreaks. If you look at the number of outbreaks we've had in the last 25 years, starting with SARS, MERS, Zika virus, 2 pandemics, the H1N1 pandemic, the COVID-19 pandemic. Every year you hear of a new outbreak, monkeypox and other things. So we have to have a good surveillance system for any outbreak and have a plan in place so that we can contain it and prevent it from spreading, because that really causes a huge strain on the health system, which is already actually overburdened. So I think that is the second challenge that we have as far as the Indian health system is concerned.
Absolutely. I think the bigger problem is not the spread of the flu or the disease that you're talking about. The bigger problem is the spread of the rumors that happens. And I think that really creates a panic and also puts a lot of pressure on these first line of defenses like the primary healthcare centers. And Professor Mehra, we are talking about equity here. And the journalist in me needs to ask you this question. Every time we hear someone in power speak about the success of a health program, they talk about how many patients have registered. The reality is, equity is not about input. It's about outcomes. It's about how many people have been treated successfully, how many people have actually availed that facility. Do you think there needs to be a system put in place in India wherein every single district we're able to monitor the number of patients that come in and also the way we have been able to treat them, to just ensure that there is some sort of an equity when it comes to healthcare?
Oh, sure. This is a very, very important issue. By the way, we have excellent centers of research and diagnosis. We have excellent scientists as well. But these are all concentrated in the big cities. And I'll give you one example over here. I have been the chair of the scientific advisory board of this very important institute where the local MP was a friend of mine. And, this place is full of sickle cell disease and thalassemia. And why were these guys only taking samples from Mumbai area and thinking out some study or the other? So, we sort of made a plan that we want to establish a satellite center of the NIIH of Mumbai over there in Chandrapur, and lo and behold, it was done. And now today, this is a very functional center. And I think this model of having a satellite center attached to a big sort of research institute or a diagnostic institute elsewhere would be very, very useful. And, also, today is the time when we have to talk about implementation research, the operational research and all. This is also relevant from the larger context of global public health. We need to have the implementation research. Implementation research, I have seen over the years, acts as a driver. It acts as a driver to close the gap between knowledge generated and its use, reaching the masses without too much of time lag. And you need a real-world evidence. You get the real-world evidence when you work over there where the disease is so very common. Another of my experience, and I want to share my experience of early 70s. My scientific career started in early 70s and mid 70s, and we used to work on leprosy. Leprosy used to be prevalent in India, very high. Out of the 10 to 12 million cases of leprosy around the world, about 5 to 7 million were in India. And we were studying the immunological aspects of leprosy. And I used to walk over to the Safdarjung hospital or the AIIMS hospital. You will not get the right kind of samples until I went to this city, Wardha, Sevagram, Wardha. Oh, where, my God, the leprosy was so prevalent that every household. But what struck me was that these were large families, about at least 5 to 7 children, all living under the same one-roof hut. And our belief that leprosy, spreads through close contact and all that. But that was not there. We saw out of the 5 to 7 children, 2 were affected with leprosy, others were not. So what happened? 1973 was also a golden time when one of the guys, Benasraf, showed for the first time the existence of what we call immune response genes. There are genes which control your immune responsiveness. So we wanted to understand if that works in leprosy as well. But we needed families. We needed families with at least 2 children with leprosy. So you couldn't get over there. So that's the point that I'm trying to make, that we need to go to the rural side, to the side where the action is. The action is right over there. I'm very happy that the ICMR, under the dynamic leadership of the DGs, earlier Balram Bhargav and now Rajiv Bell, they have already created an institution called the National Institute of Implementation Research in Jodhpur. It used to be earlier called as DMRC, Desert Medical Research Center. I was the chairman of the Scientific Advisory Board, and I said, what name is this? Desert Medical Research Center? And now they have created that into an Implementation Research Center. So I think these are the kind of things, this is very, very useful, very important sort of move on the part of the ICMR as well.
Absolutely. A lot of things have changed since you started your career, and it's very interesting to hear that anecdote coming in from you as well. It gives us an idea about how far we've come, but also we need to remember, Dr. Guleria, how far we need to go as well. He was talking about one of the things, that he said, he mentioned, in fact, was about hospitals getting a lot of technology and technology making sure that there is equity when it comes to healthcare. But the reality is, the other thing that he also mentioned is that, these set of doctors only collected samples from Mumbai. Probably they were saving on transportation costs. But the reality is, these technological advances might come to India, but there is a risk that these might be limited to cities as well. How do we push this deeper? Because again, I have a lot of friends who are doctors, and a lot of people do not want to settle in rural parts for obvious reasons. They want to stay closer to their family, closer to cities which have better connectivity, better facilities as well. So how do we convince the entire ecosystem to ensure that healthcare is pushed even closer to the marginalized community than it was ever done before?
So I think the 2 important issues there. One is, whenever technology comes in, it has to be relevant to that milieu or that area that you're looking at. If you get technology which is coming from outside and it is not going to be relevant to the Indian context or to rural India, then the technology will not work. You may get something new and you may feel that this is going to really revolutionize things, but if it is not practical and the ground reality doesn't work, then getting any great technology will not work. So the first thing I think is to understand what is happening in rural parts of India, and there's a diverse part as far as India has a lot of diversity. If you look at the health sector, let's say in the southern states, they are doing much better as far as rural parts are concerned in providing technology and being able to look at ways of implementing health as compared to, let's say, Central or North India. So there is a diversity also, which is evident even if you look at various health reports also. But I think that also brings out the point that we need to be able to understand how each area functions, what are the social implications, and interacting with the people there and understanding their issues and then finding solution is more important than trying to get something straight from outside and trying to look at technology being sort of pushed out there. Second issue is how do we get doctors to come to rural part of India. That is a big challenge. As was mentioned, 80% of doctors still continue to be in rural India. I think we need to develop a connect. We need to be able to develop infrastructures which is there in rural India, which will attract doctors to go there. It's being done that various district hospitals are being converted into medical colleges to provide those type of facilities. Primary health centers are being upgraded, but it's a slow process. And I personally feel that there is a need to develop partnership here. How can the private sector come into rural India and look at a model where there is profit also, at the same time it delivers in terms of providing healthcare. That is going to be the solution that is going to really take it forward. Otherwise, just saying that it has to be done only by the government sector is going to take very long, and we need to develop a public-private partnerships sort of a solution where we can develop facilities which are there using technology and using various other methods in rural India to provide healthcare which is of high quality and is able to and is affordable for citizens out there. But this has to be done as some sort of a partnership rather than relying on it. And I think there also has to be a lot of public involvement. Like I said, you have to understand the local situation out there before one goes in. And as was mentioned by Professor Mehra, that, for example, in Wardha you had a lot of leprosy. You hardly had it in other parts. So you have to understand what is the local issue, and this could be different in tribal areas. It could be different in northern parts as compared to the northeast part of India. So each area has to have its own problems and and you have to develop its own solutions.
Absolutely. It's interesting that you talk about it being a real issue, because I've spoken to a lot of doctors across the nation. There was a friend of mine as well, not taking any names here. He's a doctor. He was being posted towards a rural side, and one of the things he said is, well, I can't even order burger online when I want to. That's the problem. And why should I move to a rural place when I can sit in a fancy hospital in a city like Delhi or in Bangalore, order whatever I want, work during the hours that I see fit? Professor Mehra, what's the incentive that we can give, not just to the doctors, but also the entire ecosystem in terms of policy to ensure that all of these technological advances that come in, they don't be limited to fancy hospitals in cities like Delhi or Mumbai? How do we push it deeper?
I'm of the view, the example that I gave it of Mumbai, and I think that has been a very successful model actually. Large research institutions of ICMR, of the DBT and all, I think these have to have satellite centers, not just one or maybe more. You have to look for. The country is too big. The diversity that we have in the Indian population is very, very high. And the needs and requirements vary from one area to the other. So I think we need to have that kind of a model actually. I can give you my own example of starting this whole subject of transplant immunology. Transplant immunology and HLA, and Randeep knows, is a rather new field, and we were struggling in the early 70s of organ transplantation there because there's nothing in India. I don't know how I developed that kind of an interest. Maybe through this leprosy studies, it took me to the immune response genes and wanting to see. And, the transplant activity in India was very, very low. And there was only one lab. I had the only lab in India, which eventually AIIMS actually established it into the full-fledged department of transplant immunology and immunogenetics. And now, and our job was not only to test for everybody around the country. I used to feel pain when people from South India, from Chennai or way down Kerala, used to travel all the way to Delhi to get their testing done, because those were the days then we could not even ship samples from one part of the country to the other, because the DNA samples were not there at that time. And now, of course, things have changed. And one of my goals was to train people. I have trained hundreds of people in the field of transplant immunology. I'm very happy to say now that there are more than 100 hospitals in India who actually are engaged in the field of organ or bone marrow transplantation there. In each one of them want to have a full-fledged lab, if not a full-fledged department of transplant immunology. So I think these are the things that we need to do. We need to really get together and focus on areas that are lagging behind in India.
Absolutely. Like our experts here very clearly pointed out, when it comes to growth in healthcare in India, we need to stop looking beyond fancy hospitals or more doctors. That's not the definition of growth in healthcare. I think the real definition is when every single person, every single community across the nation feels a similar advancement when it comes to technology in terms of healthcare and actually feels the effect on ground as well. Dr. Guleria and Professor Mehra, it's been an absolute pleasure speaking to you. And again, once again, a big round of applause here for our experts. Thank you.
Thank you, Ashish, and thank you to our panelists. A fascinating back and forth, and I ask that Rohit Chadda please kindly to join us on stage to felicitate our panelists with a small token of our appreciation, a symbol of our gratitude. Thank you for being here at the India Health Summit and Awards 2025. All right. Pooja Sethi will kindly have you on stage to do the honors and present each of our panelists with a token of our appreciation, please. Thank you, Ashish, for doing the honors. For Dr. Randeep Guleria and Dr. Narinder Mehra, huge round of applause once again. And thank you for being here at the second edition of the India Health Summit and Awards 2025. Excellent. A lovely back and forth on making health equity in India a reality. Thank you. Thank you, gentlemen, once again. And thank you, Pooja, for doing the honors. So we'll now switch gears and move on to a topic of urgent